unmuting, saying hi here.
Ms. Riaz,
Here.
Dr. Garza,
Here.
Dr. Cunningham, Bishop Hankerson,
Bishop Hankerson is on a plane right now, and so I doubt he's going to be able to jump in unless he gets to his destination faster than expected. So,
you have a quorum.
but we have a quorum, but we're good. Thank you, Tricia. I appreciate that. All right. First item is just to approve the July meeting minutes. I moved for the approval of those minutes. Is there a second? Thank you, Tim. I hope people have had a chance to review them. I didn't see anything that I would suggest editing, but is there any discussion on those July meeting minutes?
Other than that, the nice job was done.
Yes. Thank you. Yeah.
Dr. Smith,
Aye.
Dr. McBride,
All right.
Ms. Riaz,
Aye.
Dr. Garza,
Thank you. That passes unanimously, so those minutes are approved. All right, the next item on the agenda, recruitment. So this has probably been one of the things that we've spent the most time talking about over the last year and a half, and I know it's been one of the things that you, Scott, and Randy, and many others have spent a ton of time on, and I think we are getting close to being fully staffed. I think by, within the next few weeks, you've got a couple additional, I think, job fairs or kind of fast track hiring fairs going on in the coming weeks. But can you share with us where things are? And after you do that, can you give us a sense of what has been the most effective? Because you've had about 5 or 6 different kind of strategies and approaches, and I'm wondering what's borne the most fruit, so we can kind of just, this won't be the last time we have this challenge, right?
Yeah. Okay, great. Yeah, so by the end of this month, we will have filled all of our vacancies, including those that were not funded in the budget. You may recall back in April, we went back to the council and requested that 27 of those 54 positions be funded because we had filled those and did get the approval for that. And so as of Monday, we have filled 26 positions. That brings us to the point where we need those additional 27 to be funded. And we have 27 that are lined up to start on September 3rd. So we will have filled all those vacancies, and I'm very proud of the work of our recruitment team. And some of the things we've talked about up till now are that we have a Department of Labor certified apprenticeship program. We're the only correctional agency in Missouri that has that. And as a result of that, they'll have a portable certification recognized by Department of Labor. And that also is recognizing the quality of training that we have for new officers. Many jails provide 1 week of training, and here we have 4 weeks of classroom training and 3 weeks of on-the-job training, as well as that apprenticeship during the first year. When they complete that 1-year apprenticeship, they can receive 30 hours of college credit at a community college. And so that's, there have been several staff that have benefited from that. We also have staff that have benefited from a 1-year housing allowance that's also attached to that in partnership with the Veterans Administration. And recently,
That 1-year housing allowance. Tell us more about how much that is, how it's distributed.
one of the officers here received a check, I'm told, of $14,000. So it's a big incentive. And the way that works is
Does that go towards a down payment on a house?
it's through GI Bill funds, if they have GI Bill funds remaining, and they have an honorable discharge. And then when that can be for up to 1 year, because the apprenticeship is for 1 year. And so that's something that's available to others too. But the key is that there has to be a Department of Labor certified apprenticeship attached to it also. So we're continuing to recruit veterans, and we just we're able to get some help from a recruiting company that's helping us do that. And so we're having good success with that as well. So I think that fortunately for us, while others are still losing staff, we're gaining staff. And I know that the pay increase was very helpful as well. We had been losing staff prior to that. So, but we should be fully staffed by the end of the month, and just a lot of hard work on everybody's part.
So you're hearing from colleagues in adjacent counties or other cities around the country that they're still struggling?
Definitely, yeah. Majority of people in the corrections field are losing staff, not gaining staff.
Yeah, no, I know, like State Department of Corrections, I know has been struggling and is looking for kind of innovative ways to recruit. Do board members have questions?
Yeah, I raised my hand here, Jeff. And that all sounds like good news and congratulations on that. And I don't mean to rain on the parade, but I wanted to ask one question. When you speak about this, are you speaking about corrections medicine? I mean, the officers' open positions, or are you talking about the medicine positions? Is that separate? I need.
Medical is separate, operated by Department of Public Health.
Okay, so we can ask Kanika about that when she gets here. So you're being specific to the officers, right? Is that right?
Yes, yeah, that's correct.
And maybe this is a question for the dashboard. So, I can hold the question until then, but when I look at the dashboard, it says open position 61. So how does that line up with what you're saying, or, how does those numbers?
Hey, Tim, I think I know why that is. I'll explain when we get to the dashboards.
Okay, I'll hold my
Not
question.
worry. Yep.
Got it. Thanks.
Alex?
That was more just a comment, Jeff, around the challenges for staffing at correctional institutions. I don't know if anybody saw the Sunday New York Times, a big article about the prison up in Waupun, Wisconsin, about them being on lockdown for like 3 months or something like that because they just didn't have enough staff. So really just a comment about the challenges and a word of thanks for the director and for the staff for working so hard to get us fully staffed. That's a great accomplishment.
Yeah, and absolutely, and we'll talk to Dr. Cunningham when she jumps on about the corrections medicine side.
Oh, no, I was just getting ready, comment on what Doc just said. When I visited, Texas, jail, they was 90 short, and I was going to see, their mental health unit, and they was asking me questions on how we did our recruitment. So we kind of helped each other. So, but yeah, you was right. They was 90 people short. Yeah, so a lot of jails are short.
Well, that's a good segue into talking about our mental health unit. Do you want to have an update?
So we at the county council approved the agreement with the State Department of Mental Health for them to provide on-site competency evaluation and restoration here in the jail. So we're one of 5 jails in Missouri now. We'll be the first that's implementing this process, and that will provide us with at least 3 counselors from the State Department of Mental Health and some staff from local providers as well. So we have created a mental health unit. We mentioned this at the last meeting, and that's operational. Department of Public Health has behavioral health staff, as well as we have places for people and others, community agencies that are here in the jail, which allowed us to move some people from restricted housing units into a unit where they can receive therapy. We have an evidence-based curriculum called Seeking Safety that's being provided. And so to encourage you all to come and once we get this established with the Department of Mental Health and visit and learn more about it. But we're very excited about this, and I think it's going to be something that once we show it successful here can hopefully benefit others throughout the state.
Can you talk about what Places for People staff do here and kind of how that works and what the kind of diagnostic process is to get them brought in?
Well, we have several things that we've established. And so we have a new process that started about 8 months ago where we're screening people at intake to identify people that may benefit from a referral to places for people and to get them established with counseling. And then we also have our MacArthur, funded by the MacArthur grant, our population review team that meets weekly. And we're reviewing cases, and we did establish a special meeting each month now for people with mental health needs and places for people's represented in that group. So when there's someone that officers identify that maybe we didn't have information about, they can also bring that to the attention of Department of Public Health and places for people. DPH now has a psychiatrist on staff as well as their doctors, and we have some other groups helping too through the Integrated Health Network. We have Relink, which are even identifying people at the arraignment phase, even if they're not coming into the jail, to help refer them to resources out in the community. State's been providing a mobile unit to come here for about 1.5 years now. We established that based on the delay for competency assessment. So that process will still continue.
A mobile unit with a psychiatric
Right.
evaluation?
Right, so they come in to provide care for those with the most serious mental health needs that were on that waiting list. So these are all things that we've done to address mental health, and I'm excited to say I'm planning to stay on some behind the scenes to help make sure this is fully established, and also to continue to work toward getting a mental health diversion center in St. Louis.
Great. Are there questions from the board? Hey, Dr. Cunningham, good morning.
Good morning. Sorry for the delay. Good morning.
That's okay.
All I can say is this is just great news, and kudos to Scott and the staff for all the work they're doing on this. And I'm the evaluator, and the professor in me wants to ask a lot of questions about the impact of this, but I know it's too early to do that. But I'll be very eager to see that as we go along. But I'm sure Alex could speak to this. But I was also excited to hear about the services you're providing to people who might also then leave to go into the community, because given the mental health shortages in the community, and just for the audience, I think I know this, but can you tell me again or maybe Dr. Cunningham knows, what the percentage of the intake is that have some mental health challenges? Do you have a sense of what that number is?
Yeah, it's about 40%.
That's what I thought the number was, so thank you.
That holds true across the country in prisons and jails as well.
That speaks to the importance of this. Thank you so much for your hard work.
Yeah, the other piece of this that I didn't mention, which is the next item on the agenda, is that we also have registered everyone that was eligible in the jail for Medicaid once Missouri expanded this, and we've talked about this up until now. But we're working on a new initiative now, DPH and Justice Services together, to look at how we can register people for the Affordable Care Act health insurance, because some people aren't eligible for Medicaid, and there's a new provision in the Affordable Care Act that says that people that are detained on pretrial status, meaning they haven't pled guilty yet, are eligible for that health insurance. And also they're eligible when there's a change of address. So we'll make sure that people leaving the facility have coverage when they're released. And I know there's some transitional services provided with medication, but this is going to be helpful not only for the people that are releasing, but even while they're in custody, and should lead to some significant cost savings for the county as well.
And that's going to be music to my ears, doing work on Medicaid and the Affordable Care Act. And I applaud you for that too as well. And we're in a situation now where we're taking people off the Medicaid rolls because of the unwinding, as it's calling. So I think you're pushing against that, and that's going to do nothing but good for recidivism numbers, I think. So to give people services in the community. So thank you for that.
Are there any other questions on that item? Okay, why don't we, if you don't mind, move back a little bit to the recruitment side? Dr. Cunningham, can you talk, we talked a little bit about staffing on the corrections side, on the, security side. And we were wondering if you could provide a quick update on, for staffing on the corrections medicine side, and how are things going? I know it's been tough over the last couple of years to, to try to get close to fully staffed, and we wanted to kind of see where we are and what strategies DPH is embarking on to try to fill some of those openings.
Yeah, definitely we are not where we are before before I came. And so one of the goals I put in place was for us to reduce our reliance on contractors by 40% over this year. And so we've kind of slowly went away from utilizing contractors for physicians, nurses. We also had a few contracted CNA positions as well. And so kind of going with the whole, with the public health department, recovery and reset. And I've been telling people it's kind of a rebranding for the health department, just given the devastation caused by COVID-19, that we're really pushing the mission behind entering public service and restoring the values of what it means to serve the community and serve people. And with that, we've been so far successful at hiring in a new director of nursing. That's a brand new position. She started back in April. She's doing phenomenal. She actually came from BJC. We also have a nurse manager. Those positions were vacant for the last 6 months before I started. So nurse manager who was a previous BJC ICU nurse. And then just yesterday, they extended another offer for another nurse manager. We have 3 nurse manager positions that were vacant. One was filled by the nurse a few months ago. We extended an offer for another one yesterday. And as far as with nurses, that one is still kind of a mix of getting in some contracted nurses as well as trying to recruit in through DPH, just because, our nurses are critical to the delivery of care. So that's the other area that we're also trying to actively recruit to reduce how many contracted nursing positions that we have. As far as our providers, we were short-staffed with our PAs and NPs, and last week, we hired in a new PA as well as a new psychiatric NP that's hired through DPH and is not a contractor. And my new medical director, that was a contractor position too for the last 3 or 4 years. And I successfully filled that with a DPH medical director who starts September 3rd. So that's exciting news for us on our end. And so what worked, what hasn't worked, I think just unfortunately across the healthcare system that there's still an exodus of people leaving healthcare or either going to hospital systems, or you have more people doing locum tenens because they pay more and they don't have the added responsibilities of, continuity of care and everything else to go along with it. So this is not anything that's unique to DPH. Is, unfortunately, all of our healthcare systems are struggling in the same manner right now. So hopefully appealing to that side of individuals, will be able to successfully recruit. And I just have some organizational recruitment things that we're going to do to really push out into the community. So you may see more about public health and what we do, and highlighting key positions throughout the entire public health department, so people will understand that we do more than COVID-19.
Wow, you packed a lot of information into a couple minutes there. I appreciate kind of the granular detail that you shared with us about different positions that you're hiring for. It sounds, based on kind of what you're explaining, that several of the positions that we were contracting for, we've now brought in-house. I know that at the peak of the pandemic, I think we were paying like $220, $230 to get traveling nurses in.
Yeah.
I think that's come back down to earth a little bit, since the end of the pandemic. But I'm wondering, since we've been able to get some of those things, we're moving some of those things, though not all, back in-house, have we seen a positive impact on the cost side from any of that yet?
Not just yet. We're actually going through our internal budget analysis. So I don't want to speak too quickly until I actually see the numbers. I'm hopeful given how many DPH positions we fill, but I can't say for sure yet if we've seen a significant impact on the budget side just yet.
Okay. Alex, you probably have some thoughts and feedback.
Yeah, just in general, Jeff. So there is one of the biggest issues, if not the biggest issue in healthcare right now, is workforce. A lot of people left the workforce because of after COVID. A lot of people decided to retire because of COVID, and a lot of people just changed careers because of COVID. And so, it's a big supply and demand issue. I do think that it's starting to turn slightly, or at least we've noticed that there's not as much, you're not paying those exorbitant traveler rates anymore. So those are starting to come down. And I think people are starting to settle back into a more sustainable staffing environment. But there's still, and this isn't new, this has been ongoing even before the pandemic. It just was exacerbated by the pandemic. And so it's going to take a while to get out of the hole that we're in. It's going to be a years-long process. There's no easy fixes to it. So you can say the same thing for numerous other healthcare providers. So whether it's mental health, whether there's a physician shortage in the United States, there's, rad techs, ultrasound techs, you name it. So if any of your friends want to go into healthcare, it'd be a good time to do it right now. So, but it's a challenging time for everybody.
Agree with that.
Well, thank you. And as I said, just hearing you talk with such specificity about the different roles that you're interviewing for, extending offers for, definitely gives me confidence that you're focused on this and paying close attention to it and working hard to get those positions filled. About how many nurses short do we remain here at the jail?
Let's see, we include our contractors and the DPH vacancies. I would need to get you the exact number, but I believe we're short about 5 or 6 DPH positions that could potentially be filled by nurses. But that's also including because we provide the medical care at Juvenile Detention Center, which does not fall under Scott, but our correctional medicine team spans both. And so for us, there's overlap in the providers who provide care at the adult jail also provide care at the juvenile detention center. So when I give our numbers, it's spanning both locations of juvenile detention services as well as our adult medicine care at the jail.
Okay, thank you very much. Yeah, and whatever data that you get back, from your team in the coming days and weeks, I'd love to just get a better sense of it. So it sounds like we're in a better place than we were in a year ago, but
I agree.
much better place than we were in a year ago. Not quite where, still have some goals to meet. And I really, appreciate you sharing all that with us.
No, you're welcome. But I think that honestly, I wasn't here a year ago, but I know one thing that's been a big help is just the collaboration with Scott. I feel like a lot of the breakdown in communication and maybe some of the things that came up was, we had 2 teams trying to work physically in the same space with, different goals. And so I will say, I think part of it, that teamwork and that collaboration kind of trickling down from Scott and myself down to our teams really helped the team for justice services and corrections medicine to work more together to provide care for the patients that we serve over there. So say all of that because I'm going to miss Scott, but I do think him and I working closely is one reason why both of us are seeing such great success right now.
Absolutely. Thank you guys for that. And Tim, definitely echo what you just typed in the chat. Appreciate both your leadership. All right. If there's something else, unless you have something, Nina, then why don't we go ahead to the next item, which is, I know, kind of been a personal passion of yours. Since you've come here, it's something it's also been a passion of mine, watching you bring college, opportunities to our residents. You shared with me recently an anecdote that one of the community college professors said that their students here were paid much closer attention to instruction than their students outside. So I want to just give you a chance to give us an update, share a few of the numbers with us.
Okay, great, thanks. Jeff, we added a third cohort of classes. They just started on Monday of this week. And so now we have 38 students enrolled in college courses. They're taking history, reading, philosophy, oral communications, algebra, and statistics. And we're hopeful that we'll be receiving a grant from National Institute of Justice that should be announced in October, which would allow us to expand this even further. We have that application in, and we're hopeful. But this is a great partnership that we have with St. Louis Community College. The instructors, I'm told, are fighting each other because they want to come in here and be a part of this. So it's really exciting. The students are working hard, and I'm not only did the professors say that they're paying closer attention, but I believe the average GPA is 3.75. Is that right?
Yes. In fact, two of our students qualified for Phi Theta Kappa this semester, and we have 10 more that will qualify at the end of this semester.
Fantastic.
And it's almost 100% of our population. So we're very excited about the progress that they're making, the effort that they're making, and most importantly, the success. I would like to reiterate that the curriculum is exactly the same curriculum as on campus. No special provisions have been made. We want these individuals to be able to transition directly to an on-campus class. And so we're really excited about the success that we're having.
Yeah, hopefully we'll have some students releasing and enrolling in the community soon, and they'll be provided a laptop through the community organization so that they can continue.
Who's that organization?
Caritas.
Okay, that's great. Yeah, I read a few years ago that the Rand Corporation had done like a meta-analysis of prison and jail secondary, post-secondary education programs that showed that, and then tracking people longitudinally, I think for 5 years after release, and it showed that there was a 43% reduction in recidivism among people who had earned any type of post-secondary certificate while they were incarcerated. Hopefully we will see. I love that they're expanding their mind, broadening their horizons, and hopefully we'll see downstream impact of that and reduced recidivism as well. Any questions from the board? Okay. So the next item on the agenda is housing of federal detainees. I know this has been something, I think that the difference between our reimbursement for people that we're keeping who are awaiting state charges versus federal detainees, I think we get like 5 times as much. We would get about 5 times as much for federal detainees, something like 130 bucks a day per person, and we get something like 24, 25 bucks, something like that per day per state. Can you give us the exact numbers and then share with us kind of where things are with that? I know you have, since you first looked at the numbers when you got here, you said we need to find space to get that contract back because it will help us do so many other things based on that revenue.
Right. Yeah, so the state reimbursement rate is consistent across Missouri, and that's established by a committee, a congressional committee, and it's $22.50 per day. And we're hopeful that will increase. The law actually allows it to be up to $37.50 per day, but that committee has kept it the same for over 20 years. The federal contract that's in place now and has been for several years is $93. That was suspended due to a staffing shortage under the previous director. And so with our staffing levels coming back to where they should be, we anticipate that we'll be able to begin renewing that contract as early as October 1st. And uh, the negotiation that's ongoing now is one that hopefully will be closer to our actual rate of
Our
daily,
cost
which
preferred.
KPMG had determined to be almost $125 per day.
Okay, well, good, good. I think it's not gone great from what I understand for the feds to be housing people all over in Kentucky and I mean, I think people are like 6, 7 hours away from this metro. So I know they're incentivized to want to, bring people back here. So hopefully that negotiation will be wrapped up soon.
Definitely.
Questions about that pending contract or?
Not exactly. The only thing, and I may want to get back to it when I get to the dashboard, is we have space for all these folks.
We do have space, so we currently have opened 2 additional units due to the population increase here, and the dashboard will show that the population has increased by 33% since January 1st. The mental health unit that's been opened is just moving people, but the population increase now is what's caused us to open some of those additional housing units that have been closed. But we still do have 2 vacant housing units, and we just finished some interviews for community corrections officer yesterday, and our plan is to bring 4 additional community corrections officers on that can expand the number of people on GPS location monitoring, because the court has indicated that would be an option that they would entertain for people that had been here in custody if we were able to provide that closer supervision. So we're working to, even with our PRT meetings each week, to identify people that could be released.
And to clarify, the break in that contract was never about physical space as much as it was about staffing.
Right, it's solely about staffing though, yeah. But we do need to make sure that we're managing our population and that, and when I think what I wanted to say, when I started here, there were about 120 people that owed less than $500 bond. And we created the GPS location monitoring program because there were people here that couldn't afford the private GPS location monitoring. And so we've had great success there. I think on a daily basis now we have less than 6 people that are here owing less than $500 bond. We have the Bail Project that's helping. We have transitional housing, which we've never had before. And we have a clergy mentor bond program, which I don't think is being done anywhere else in the United States, where they're matched one-on-one with a clergy mentor and sponsored by a local church. So really proud of the staff here and all that they've done the last couple of years.
Thank you for that correction, Jeff. I'm glad you brought in that nuance. Thank you.
All right. Any other questions about potentially housing federal detainees? Okay. Next item, progress report on the review conducted by CGL.
So there is one item left that's not completed, and that is moving 10 officers to transportation. But I do anticipate with the addition of these staff coming on board that once this class is finished with training, we should be able to meet that objective before my retirement. So I'm really proud to say that we do have some ongoing items on there, and that is that we continue to recalculate our shift relief factor. And what that means is if you have people that call off, they're sick, they don't come in, that you have enough people to cover those posts during that time. So that's continuing to be monitored. And we're going to be in a position actually now where we'll actually be able to have those staff on the schedule, which would be a great thing. While we've been short, we've not been able to do that. And so you should see the overtime hours being reduced even further. I think we've cut those by 50% in the last year, but with us being fully staffed, that'll continue to decrease significantly. There's another item on there that CGL had recommended, that we have one officer, eventually get to one officer per pod again with a rover. And I made the decision as director to continue to have two officers in each housing unit based on the population and the severity of the offenses that were being housed here. And so that one we're not implementing, and at least haven't been under my leadership. We have made the change through attrition with having unit managers in the housing unit instead of the majors. There was a recognition from CGL that we were top heavy and had too many major positions. So that has happened now. We have one major over the housing units, one major over intake, and one major over the internal affairs branch.
Can you talk about the impetus for the 10 additional officers in transportation?
Well, see, it's actually because CGL noted that we're short-staffed even beyond the funded level. They said that we should have, in comparison to other similarly sized jail and the officer ratio, we should have 82 additional officer positions. So the transportation unit during the pandemic, while courts were on pause and there was less movement, but even between jails and prisons, the transportation staff were pulled into the jail. But the courts have fully reopened, and there's a need for us to make sure that we have people there waiting and that we're not delaying that court process, and to be able to move people. A lot of the medical visits are in person now and less remote. So we definitely do need to have those 10 additional officers in the transportation unit to get us to a level that we can meet those needs. And we did receive 16 additional positions last January in this year's budget, and we have that in our budget again. May even see that we get some additional funding even before the end of the year, if we're hoping, so that we can continue to hire, because we do need additional staff still.
That all makes sense. For the public's benefit, can you talk about your thought process, which I know a little bit about, and support your decision to eschew the CGL recommendation around, having just one CO per pod. Can you talk about that in the context of this facility's recent history?
Well, so prior to the pandemic, there were, and Senate Bill 5, which was passed, which impacted the number of municipal ordinance violations. The population of the jail had people that were here for misdemeanors and municipal ordinances. And then when the pandemic started, the focus was on more violence.
And just to give people a little context, so Senate Bill 5 was like the post-Ferguson legislation that limited municipalities' ability to really, the percentage of revenue that municipalities could get from things like traffic tickets. And so there were municipalities that were getting like 50% of their revenue from stuff like that, very low level of misdemeanor offenses. And then some of the people ending up here after SB 5, the number of people who were sitting in municipal jails and coming here from municipalities for those low level offenses, I'm sure plummeted.
Yeah.
So the mix of people, and thanks to that and the population review team, the mix of people in here tended to be much higher level offenses than it was, say, a decade ago.
Yeah, so right now, as a result of the pandemic and the focus on those more violent offenses, almost 20% of the jail are here on offenses that are related to murder. And about 85% of the cases here in the jail are Class A and B felonies, which are more violent offenses. And the length of stay has been longer for those cases. because of the pandemic in part, and, but some have been here longer than the pandemic. There was, as we talked about, with delay for competency assessments. So those are some of the challenges that we face as a facility, which are faced by people across the United States. But I can say, having toured other jails, similar sized jails, I see 2 officers in each housing unit. Law enforcement agencies went to having partners 20 years ago, because it's been shown through research that people don't even initiate type of assaultive action if there's 2 people. It reduces that significantly. In addition to that, it provides witnesses. If something were to happen, it provides someone that can call for help. It provides extra eyes and ears to be observant. And our concern is for safety of staff and the residents. So we want to make sure that we're maintaining the safest facility possible. So my goal, one of the first things that I did was to put 2 people in those housing units. And when you have many new officers, it's also helpful to have 2, because we want to make sure that people are trained and able to operate those.
And this was the subject of some public controversy because of the assault on a CO that took place last fall when there was only a single CO. And I think it surfaced that there was an internal memo from a senior administrator here trying to push the 1 CO per pod policy in violation of your directive. And am I right in understanding that the individual who was responsible for that memo is no longer employed here?
Unfortunately, we can't talk about personnel issues, and I know there was an article that mentioned some of what you're talking about, and I think the key here is that we have very dedicated staff. We have a lot of new staff. We have new supervisors, because one thing that wasn't mentioned with the vacancies is, as we've grown, we've had to promote people from officer to supervisor, which creates additional officer vacancies. So we've actually hired many more officers, but there were additional vacancies just because of the need to have supervisors. And Nate Hayward shared with me that the goal all along when this facility was built was to have 2 officers. Could you share a little bit?
Yes, back in 1998, the jail was getting built. We went to Johnson County to get trained. And Johnson County, they had 2 officers with 20 residents. And when they was building this jail, they told us this is how this jail was going to be built. But when we came into the jail, there was 64 residents, so they put 1 officer inside that housing unit. Then they said once it reached 67 residents, they was going to go to 2 officers. We hit 67, we stayed with 1 officer. So they said if it goes up to 72, we would go up to 2 officers. Never happened until Mr. Anderson came.
Okay, thanks for the historical context. Any questions from the board? Go ahead, Tim.
Yeah, thanks for that report on the CGL audit, Scott, and the questions. And the one change I saw or heard you discuss relative to the recommendations seems reasonable to me. But my comment is going to be, I think there was a spreadsheet that was kicking around that had the recommendations in it and our progress towards them. And it's probably just my bad filing capabilities, but if it could be updated and resent out to the board, I think that would be helpful to me to keep track of. I think there were like several dozen recommendations, so I think it'd be great to see that and just see where it is.
It's updated. We'll attach it with the minutes.
Thank you so much.
I'm hopeful that that we'll continue to have 2 officers per housing unit. I think if the facility has been much safer. We had not only the CGL review, but the American Correctional Association came through providing accreditation. We've had others from National Institute of Justice and other agencies that have commented on this jail, their experience feeling much safer here than in other facilities. And we received the highest accreditation score of other jails during the past year when we went through that process. So our facility is extremely well maintained, and we have an excellent management team, supervisory team that's making sure that safety is our priority.
All right, any other questions on the CGL report? Okay, I will now entertain a motion, if there is one, from the board to go into closed session, to discuss our, revisions to a vision statement. Is there, anyone who wants to make that motion?
Mr. Chair,
What?
you should, the motion should include the
Citation.
citations.
Okay, entertain a motion to go into executive session pursuant to section 610.021, parentheses 1, and section 114.020, point 1, parentheses 1, of St. Louis County revised ordinances. Is there a motion to do so?
I move we go into closed session.
Is there a second?
Second.
Thank you. All those in favor, do we need a
I'd recommend
roll
a roll
call?
call vote.
Yeah, okay.
Dr. Smith,
Aye.
Dr. McBride, Ms. Reyes,
Aye.
Dr. Garza,
Aye.
Dr. Cunningham,
Aye.
Okay, by unanimous vote, we have decided to go into closed session. This shouldn't take long for those of you who are watching in public. Do we now need to get off this line and go to a different?
no, IT is supposed to
Oh.
do a breakout session.
Okay, IT will do a breakout session.
Yeah.
Okay, is Ray?
He's on.
Yeah.
Okay. So if you're a journalist or member of the public listening, just stay where you are, sit tight, and we should be back in a few minutes.
They're gonna move us.
Also.
Okay.
Mr. Chair, any staff people who don't absolutely have to be here should leave.
The mission statement and vision statement. I'll read our proposed new vision statement with a slight amendment, if that's okay with you, Nina. The vision of the Justice Services Advisory Board is to advise the Director of Justice Services on affairs related to the provision of secure custody and safe supervision of individuals incarcerated at the St. Louis County Jail, prioritizing its reentry efforts and implementation of recommendations from the 2022 CGL independent audit. While the board does not discuss specific cases or issues pending investigation, the board will consider written public commentary before advising the director on policy and procedure. The board will revisit the vision statement in December 2024. Are there any questions or discussion about that revised vision statement?
So Jeff, maybe just a comment and apologize. Thank you, Nina, for taking this on. So this is a little bit different than vision statements that I've worked on in the past for many different organizations. So, and the reason why I bring this up, the vision statement should really, it should be not that specific, right? So it's really, you're trying to paint a big picture of what are we trying to do. So at the end of the day, what would we want the vision of this board to be? So I just, my opinion, we shouldn't get into the granularity of surveys and things like that. I think, my opinion, it should end after that first period, because that really encompasses everything that you're doing afterwards. You just don't need to list out everything. Otherwise, you have to revise the vision statement, every time a new report comes along or a new inventory comes along, things like that. But vision statement should really be where do you want to be if everything is successful? And I apologize. This is the first time I've heard the vision statement. I know we saw it a couple months ago, but.
Nina?
Well, I think that it helps to have clear priorities to guide us in the direction, and that those priorities do change over time. Eventually, at the rate that the county jail is going with implementing the recommendations, eventually we would not be referring to that report anymore. But something else may come up around the time once they've completed all the recommendations that would then take its place. So I think revisiting it regularly and giving it some specificity would help us garner our efforts and be more efficient in how we advise the county.
And Alex, you're wanting to strip the second two sentences.
Correct. So if you think about strategy development, you have vision, mission, core values, strategy, right? So then it gets down to the goals. And so to me, that second piece is really, that's your strategy, but your vision should stand alone as an over-encompassing statement on this is where I want to be. If I do everything right in my strategy, my goals, my implementation, this is where I should be. So that's what I'm used to doing. I'm not saying this is not good language. I'm just saying, is it appropriate for a vision statement?
I'd like to comment on that. I actually agree with Dr. Garza. So when I was reading this, and typically my experience of vision statements, I agree they are that high level overview, but it's more so inspirational and provide the guidance. And I feel like with this, it is very narrow, but I also feel like it's missing key components that me being a member of this advisory board, I believe no matter who is over there, no matter why they're there, like this vision statement does not speak to the importance of making sure that we have an equitable approach, that we're up to date on the policies that we would like to guide our director on. It just seems like it's just so just being frank, is bland. And I don't think it speaks to what our true role could be to really support justice services, but also support the individuals that's housed at the jail right now. So that's my concern. I agree with Dr. Garza, but I also feel like I actually would like to change that first sentence to make sure, I get we say prioritizing its reentry efforts, but just working with Scott, there's multiple different priorities, but one, making sure that we're treating everyone in an equitable approach. And I think that takes precedence than reentry, than the audit, like restoring humanity in the individuals that we serve over there. That should be a priority. And then also our employees. So that's just my comment. I just want to put that out there that how this stand, I would like to rework that and to make sure that we have a true vision statement to guide us going forward. And I agree with Nina with revisiting because that may change. But right now, I'm speaking from my perspective and my contribution on this board and how I would like to support Scott and the next director moving forward.
So what I'd like to do, if you guys don't mind, hearing kind of the feedback from different members of the board, if it's okay with folks, I'm gonna maybe just rework it a little bit over the weekend, and then send you guys a draft for discussion over the next couple. Oh yeah, I can't do that. Okay, I'll have conversations with each of you individually. I can do that. I mean, I have conversations with them all individually. There's no quorum. I can do that. So I'll reach out to you guys individually, and we can discuss it, and then we'll come back with a proposal at our next board meeting. And appreciate, Nina, the work that you've put into this. Appreciate the feedback and input from Alex and Kanika, and we'll talk to Bishop Henderson as well. So thank you all. And we won't vote today, but we'll revisit it next meeting, incorporating that feedback. Now I'd like to just go to the next agenda item, which is a statement on the leadership change here. When we talk about the board's vision, when I assumed the chairmanship, I said that my vision was to try to create a facility that was the safest, most humane, most rehabilitative correctional facility in the country, where staff and residents alike were treated with humanity, consistently in the way that Dr. Cunningham just referenced. And I can't imagine a leader that would have taken that vision to heart and shared that vision as well and as comprehensively as you have. Between the challenges internally of some people who resisted that vision and the change that you brought, and the challenges externally, and of course just the day-to-day difficulties of doing this work, you maintained your poise and an even keel at times when I could not have done so and did not always do so. And so I'm so grateful to you for coming out of semi-retirement and taking this job on. I know that you've got family medical issues that you've got to tend to, but I know that you are leaving this place in such a better condition than you came to it as, and I wish you could stay a lot longer. But family is, and I know that feeling is shared by most of the staff here, if not all of them. So I thank you very much. I want to give the board a moment if anyone else wants to weigh in. Tim?
I couldn't agree more with what you said, Jeff, and your steady, calm leadership is great. And the last couple directors have, we've been on this board long enough to see through our maybe 4 or 5 directors. Is that what it is? Alex and Jeff. And, the county and the public need to give you a big hand for all your hard work, and you deserve some rest now and your retirement. And I just want to thank you for your service. And speaking for myself, I just appreciate everything you've done to be transparent with the board and honest, and that's much appreciated. And I was hardened a little bit to say that you're not going to go away 100%. But I hope you get some good rest for yourself and your family, and I know we'll be left in good hands. So thank you.
Nina? Thanks, Tim.
Scott, I just wanted to say thank you so much for all your efforts that you've given the county over the past couple of years. I've only been on the board for a year, and you've been the only director that I've worked with, and the amount that you've accomplished in that short time is quite remarkable. I am also heartened by the progress specifically with the mental health unit. And I think it's close to that time when I should probably give a visit and have a tour of all the successes that you've helped implement there. So thank you.
Thanks, Nina. Alex?
Yeah, so Scott, I'll just pile on the accolades. You've done a phenomenal job. I think just full stop with the Justice Services. As Tim mentioned, some of us have been on this board for a long time, and seeing where we are now, considering where we were when we first started, it is night and day. It really is, and that's due to your leadership. And so I want to thank you for that. I want to commend you for that, being a very progressive leader, an accountable leader, though, and somebody that I think truly cares for the population that you're charged with taking care of. So I wish you well in the future, and thank you for everything that you've done, not just for Justice Services, but really for the county and for all the other people that you've interacted with. Thank you.
Thank you, Alex. Dr. Cunningham?
So Scott, I truly appreciate our partnership, and we've only worked together since I started in January, but just from the beginning, you know, when we have our meetings and we share the same vision with trying to improve care and just safety and improve the overall conditions at the jail. So I just really appreciate the partnership, the collaboration, the ability for us to be able to problem solve and work through issues as they come up, and not, you know, sometimes leaders get into the name game, but for us, I just appreciate our position with both of our staffs at being able to be true leaders, and for us to discuss, you know, any issues, things that we need to work through, and, you know, hearing each other out. I've learned a lot from you as well. So, you know, being a family medicine physician, working in the jail is not my thing, but you have taught me a lot. I'm excited for you and your future, and I definitely miss you. But I just wanted to say I truly appreciate everything that I've learned from you, but then also you giving me the space to be a new young leader with ideas and supporting things that I would like to do as well that would affect your staff. So I do appreciate that, and thank you so much.
Thank you for that. Thank you, everybody, for weighing in. And just so the public understands that we're not just saying stuff willy-nilly, you know, without data to back it up. We've seen, you know, programmatic offerings expand dramatically under staff's leadership. We've seen staffing, you know, go way up, as we talked about earlier, because of his dedication to recruitment. We've seen disciplinary incidents and, you know, incidents of violence go down here. We've seen bad actors removed. And we've just seen a transparency that is rare. Prisons and jails are some of the most opaque institutions in American life. It's very hard for journalists to get in. It's very hard for civilians to get in and understand what is going on. You have said at almost every single meeting you've invited us to come in. I'm here, you know, a fair amount, but to say, you know, to invite a board in, which is not necessarily, you know, which may have perspectives different from yours, and really want to empower us as representative of St. Louis County citizens. We've appreciated, and we certainly hope that future directors will follow that lead. So thank you for that. I know you've got to go tend to a family issue right now, but it's been great working. Yeah.
Thank you. Thank you very much. Thank you, everyone. I also wanted to introduce you. You all know Nate Hayward, Deputy Director, and Superintendent Brent Kewerton. Some of you may not know him yet. And Deputy Director Randy Holman. So Justice Services is in great hands, and look forward to staying in touch with you all. I do have to head to the hospital now, but thank you everyone very much. Appreciate all that you're doing and look forward to continuing to see some progress. I still have 3 weeks left, so we're gonna accomplish some great things in the next few weeks.
Okay. See you, Scott.
Thank you, Scott.
See you later.
Mr. Chair, if I might hit, going back to agenda item number 9, because I don't know that all the board members are, and I do advise against a discussion among or with all of the board members about a draft of a document that the board will consider, and would advise that the board consider that in an open meeting.
Okay, thank you for the legal advice. All right, we'll go to the next agenda item, which is the dashboard. Aaron?
Sure. All right. Only a few things to share this month, and I can get into just for a minute or two what Tim was talking about with the a little bit of a discordance between what we talked about before and what's shown on the dashboard. So before I get to that though, the daily population as of this morning was 996. This is good. This is the first time it had dropped under 1,000 in a little bit. Earlier this week, we had peaked at 1030. So we did see a decline of, what's that, about 34 people over the past 4 days. Hopefully that's the start of a trend, but who knows? These things tend to go up and down over time. Only other thing I wanted to share this month, we did see a somewhat of an increase in use of force this month as compared to the last months, but the number this month is not particularly high. It's just that the last months were super, super low. This 35 per thousand here is pretty much right in the middle of historical data. So I don't think it's anything serious to be worried about, but I did want to mention it just to keep an eye on. I will, let me see if I can.
Before you leave that, Aaron, could you, or you or anybody speak to, there is an increase of about, I know you said it dropped down a bit, but there is an increase of about 200 people in the jail since the beginning of the year.
Yeah, well, the increase at the beginning, the increase has happened all throughout 2023. I mean, at Christmas time, we were at 745. So it has been tough. That's undeniable. I will say though, and I mean, I know this is somewhat of, only a consolation, but the rate at which the population is increasing has slowed. You see this rapid increase between Christmas time and March, where we had about an increase of 200. It has gone up since then, but it hasn't gone up at the same rate. As for reasons why it's gone up so much this year, I mean, we've had many discussions about that internally. We think it's a combination of factors. We think that probably a combination of just the nature of what's going on in the community, plus, maybe some more sort of a little bit more aggressive practices by the police and the prosecutors. But we've also seen kind of some odd shifts in the composition of the people that are in the jail, and some this increase over the past 8 months seems to be disproportionately attributed to lower level and non-violent felonies. Because if you look at and I could pull up specific data on this if necessary, but if you look at the number of, for example, murders and robberies in the jail, those are actually almost identical to where they were a year ago. But the number of gun charges, drug charges, resisting arrests, and stealings are all way higher than they were. So the composition of the jail, like the composition of this set of people that's made up this increase, seems to be concentrated within nonviolent and lower level charges.
Okay, that's very helpful. In the list of things that you suggested might be contributing to it, have you considered, or can anybody speak to the possibility that there might be a little bit of a logjam in the courts as we come out of the pandemic? Because I look at the charge service categories, and the increase seems to be in the pretrial category.
Yes, it is in the pretrial. Our jail is highly disproportionately pretrial in comparison to past numbers. And that's, in some ways, that's a good thing because that's what jails are, for. But it may also speak to somewhat of a slowdown in the courts, as you said. I don't have any specific data
Yeah.
on slowdown in the courts, so I can't say definitively. But I'm happy to hear people pitch in if needed.
No, that's fine. Thank you.
Sure.
Can we go to the correction to medicine dash?
Let me share one thing on the supplemental dashboard
Okay.
first, Jeff, and then I will let you all move on. Not many changes of note on here, but I wanted to mention one huge positive change this month is that in 1 month, our ratio of residents to corrections officers dropped from 7 to 6. You rarely see increases or decreases that quick in 1 month. So I think that speaks to the improvements in the number of staff hired. And I want to say, I think it doubly speaks to the improvements in the number of staff hired because in general, we've been going up in population. And so to counter an increase in the overall jail population, you need an even bigger proportional increase in the number of staff. And that's been achieved in the past month.
It's almost like Scott was telling us the truth earlier.
Yeah. So just for about 2 minutes, because I don't want to take too much time on this, I want to let you guys finish. But I want to speak just a couple reasons as to why Tim had mentioned that the dashboard shows that there's still only, there's still 60 open CO positions, whereas we're working toward getting closer to having them all full. I think there is generally probably approximately about a 2-month or so lag between what the reality is of where we're about to go with hiring and what's shown on the dashboard. There's about 2 or 3 really big reasons for that. One is that I actually don't have access anymore to a vacancy and staffing data that's put together internally. So I get it from the county website, and the county website might have data that's maybe not quite up to date. Like, for example, it's possible that their August data is the same as what our data was 2 months ago. I also should mention that every data point on this graph is from the first of the month. So any gains that have been made throughout the month in the last 24 days aren't going to be represented in the graph here because we're talking on the 25th. These are from the first. So it is very possible that the number of open positions has gone down from 60 to say 20 or 30 in the last 3 or 4 weeks. And then finally, I think the other possibility is that there's a delay in when people are hired or agreed to come on board versus when they actually start and all the paperwork is complete. So not to say that there, like, it's not the case that there isn't a single open position this minute, because there probably is. But I think the best thing to do when it comes to looking at this is to keep an eye on it for the next few months. And then if this number, using the publicly available vacancy data now that I use to calculate this, if this number doesn't move closer to 0 in the next 2 months, then I think it's probably a good idea for me to do some investigating into the data source and see if maybe there's kind of a discrepancy between what's being shown on the county website that I scraped the data from to calculate this and what's actually true in reality. Is that a sufficient explanation, Tim?
Yeah, I mean, that makes sense. I appreciate your willingness to take a deeper dive into this. I appreciate that you're always looking to see if there are things that are counterintuitive or for some reason don't make sense, as opposed to just reporting it, without thinking about the people and the issues behind the
I'm going
numbers.
to keep an eye on it. I mean, I think, like I said, in a couple months, if that number hasn't gone down to match the actuality of where we're at, then I would be concerned. But I think for now, we might just be seeing a lag.
No, that helps a lot, Aaron. And, I put in the chat, you're amazing and thank you for your hard work. And I know enough about these dashboards and delays and all that, you sometimes you shouldn't take it as a daily snapshot and
Right.
take that as gospel. So put all data into a bucket and interpret it. So thank you for that.
I think that's all I have on DJS dashboards. I don't have any updates. I just entered the medical data this week and didn't see any like surprising or concerning issues. So I don't have any updates that I need to discuss there if anybody doesn't have any questions. So I'm open for questions, but you all are also free to move on if not.
You want to just throw the medical ones up?
Sure.
Yeah, I don't see any trends here, but I'd be interested in Dr. Cunningham's comments about a couple things. One is as mental health unit gets brought up to speed, is there one particular or maybe it's a few of these dashboards we might be wanting to look at, or, you know, and I don't mean to be complicated, but professors do this sometimes. You know, sometimes when you actually create a unit, you might actually identify more cases than
Sure. Well, that's what happened with, I mean, I remember Liz was talking last year about that happening with safety events. The data, the ability of them to identify the events actually made it look as though there were increases, which might look like a bad thing, but actually weren't necessarily.
Yeah, I just want to point that out to people.
I mean, I don't know, because I'm, unlike with the DJS data, I'm only, for the corrections medicine data, I'm basically just the designer of the dashboard and I just enter in the data. So I'm really not sure. I don't want to speak to that when I don't know much, but certainly with the mental health unit, it might be worth keeping a special eye on a couple of those mental health fields to see if they change in the next 6 to 12 months.
Yep.
So does anybody else have any data questions for me? If not, I will pass it back to you.
I have none, unless anyone else does. I am ready to move to the next agenda item.
Can I ask one quick question for Dr. Cunningham real quick?
Of course.
And I think I know, and Alex is on here as well. We hear rumblings in the media and I read professional press about this new variant of COVID. And I sit on the St. Louis Board of Health. So I know from what Dr. Motti has said there that it's, you know, worth monitoring, but it's not, we're nowhere near where we were before. And so I just wanted to see if there's anything you either one of you want to add about that.
Dr. Garza go first. Respect his regional leadership in this space, and then I'll comment.
Yeah. So Tim, you obviously didn't hear my interview on NPR, right? So.
Oh, I did not. I'm sorry.
Okay. I explained it all there. Yeah. So it's worthy of keeping an eye on, but you know, with all of the immunity out in the population, vaccinations, whatnot, I think we're going to be okay. So there's no doubt there's increasing cases, but we haven't seen the resulting severe disease and hospitalizations. So, Kanika?
I apologize for not listening to you when I get it, but I'll go back and listen to that.
Oh,
so,
kidding. Yeah.
I think it's worth putting on the record what you just said because I just want to calm the folks. So.
Oh, sure. Yeah.
Yep. Just say this with the jail. Again, we're monitoring it. We still do our COVID assessments at intake to make sure we're not missing individuals. And then we do also offer COVID vaccinations as well as influenza vaccinations inside the jail as well. So we're keeping a close eye on it. I think before when they went through the transition when COVID was at its peak, at least we have that plan and process in place if we need to. So right now we're monitoring, continuing to screen, and to continue to encourage vaccinations in addition to the flu shot for individuals that are over there.
That's all excellent. Yeah. Thank you.
Kanika, will you have access to the new vaccine coming out in the fall too?
Yes, we should. I'm waiting to hear the details with that. But yes, we I don't see why health department should. I'm just waiting to get the details as to when we'll be able to get it and how that will work. The person who was responsible for that retired. And so I have new staff in place. But yes, we are currently figuring that out to make sure we can have it available right when it hits the market for us.
All right. Thank you for that question, Tim, and for your response, Dr. Cunningham. That is, I think, all we have, unless there's public comment.
No public comment.
No public comments this month. The next board meeting is scheduled for September 22nd, Friday the 22nd. So I will talk to you guys probably before then, but otherwise I will see you on the 22nd. Okay? I will move that we adjourn. Is there a second? What do you say?
Second.
All those in favor say aye.
Aye.
Aye. All those opposed say nay. The ayes appear to have it. The ayes do have it. The meeting is adjourned. Tim, I'll be on 97.1 this afternoon, arguing with Mark Reardon. If you want to listen to me complaining about the debate on Wednesday.
Oh, there you go. That's what I put in the chat. That's why I didn't hear you, Alex, because I try to troll Jeff all the time and wherever he's on the radio. So.
And I never want anyone to be incarcerated. But I did enjoy the mug shot a little bit last night. So.
There you go. Take care, everybody. Thanks.
What are we doing?